I didn't know what a nurse's aide was until I got deep into housekeeping and talked to a lot of the STNAs there and learned more about their job. I figured that it was more of a college thing, and it was just like this start out to nursing. I didn't know you could just be an STNA.
My mom worked in a nursing home here in town, and I swore that I would never work in a nursing home. And now I can't imagine doing anything else. So I knew that I wanted to be a nurse. I knew I wanted to go into the healthcare field. And after I graduated, I paid for my STNA, and then I applied here. I went to school full-time. I worked full-time, pregnant. I graduated in 2009 with my LPN.
Hi, my name's James. I work for maintenance. I also work as an aide tech. Getting to know the residents better on a more personal level helped me better to be able to understand what they needed me to do in maintenance for them. So some of the residents, they're not easy to understand, and some of them suffer from dementia and things like this. And so just in the short amount of time that I would have for like a work order to go in and like replace lights or fix something small, to me talk to them on a one-on-one level to understand what they need, I was struggling. So just getting to understand the people and what their day-to-day is and what they're going through helped me to understand them in a way that I can go in and help them meet their needs.
So I started here as an LPN back in 2017. I was offered in 2019 the wellness director position. In 2020, I was offered the assistant director of nursing position. I took it right at the midst of COVID, but I was able to get through it. I took over infection control right when COVID hit. However, I was able to move through that, and I feel like that's part of why I am and why I'm able to do what I am today.
I've taken care of people for, this will be 26 years. You just gotta go feed that need to help people. I mean, at least that is what it's like for me, or I wouldn't have done it for this long. And there's something so gratifying for just helping somebody, or just going to just be there for somebody who doesn't have anybody. Because that's all they need. Like, that's all they want. And there's so many people out there that don't have anybody, that is stuck in facilities everywhere. And all you gotta do is just stop in and sit down and just be an ear.
I started off in the hospital for a couple years and then went to long-term care. Did 1 year with the Ohio Department of Health and then went back to long-term care. I enjoy working in long-term care because I've always considered it a privilege. The residents invite you into their home every day. They're happy to see you. And I've just always considered it a privilege to work in long-term care.
One of the main focuses that I have in morning meeting is to help the staff that I have there, the managers, the leaders, help them understand how they can take what we're doing there in that meeting out to the frontline staff and help them cultivate an environment and an atmosphere of putting the residents first. Many of the folks that I have on my management team are folks that actually started on the front line. Some of them were STNAs, some of them were housekeepers, some of them started as entry-level companions, and they've taken opportunities with our company to develop, go to school, go to nursing training, go through our STNA program, and to develop themselves into activity directors, into LPNs, into STNAs, into maintenance directors, and even become the DON.